Welcome to the region's only public safety radio talk show. It's time again for the Sheriff's Report, your weekly radio call from Sheriff Ozzie Knezovich, now in its third year on the air.
Radio base to the Sheriff. Come in, Sheriff.
Well, good afternoon, good morning for those who are viewing this through the live stream, for those of you who will be watching this on the podcast. We tape this in the mornings and it goes out, and on radio you can listen to us on AM 630 on Saturdays at noon. Today in the audience with me is a special guest that has a really important role with our community that I don't think a lot of people even know what you actually do or how it works, but I think they know that you exist in one form or another, and that is the Washington Poison Center. And as our guest today, we have Dr. Erica Liebelt. She's the executive director of the Washington Poison Center. Welcome to the show, and kind of give us a little bit of a 50,000-foot view of what is your role and what is the Washington Poison Center, and also cover the fact that you're not a state agency.
Right. Thank you so much, Sheriff, for giving me the opportunity to be here today. The Washington Poison Center has been around for 62 years. We actually initially started as two centers, one at University of Washington and one here on the eastern side of the state in Spokane. And it's gone through a morph, an evolution of various different hospitals supporting it. And in 1993, we were consolidated into one poison center under state legislation. And we are a 501c3 nonprofit organization that serves the entire state of Washington. Again, we are not a state agency, like you said. So we rely on the support of the Department of Health, of our hospitals, of our community to maintain our services. Our services are unique. We provide 24/7, 365 emergency telephone helpline to anybody in the state of Washington, public citizens, healthcare providers, anybody who is seeking information or about toxic exposures, about potential toxic products and substances. Our staff that answer the phone are very specialized. They are pharmacists and nurses with very, very specialized training in clinical toxicology. By our national certification, and we have 100% certification of our poison information specialists. In addition, with the 55 poison centers in the country, to have physician medical board certified medical toxicologists that help me take call, because we have to provide backup call 24/7, 365, all the time. So we are free to anybody. Our information is confidential and HIPAA compliant. We have an electronic medical record that gathers a lot of data. We are a treasure trove of data and provide a lot of real-time surveillance data about poisonings and overdoses. All of our data is uploaded every 5 to 6 minutes to a national poison data system data bank, of which is under the purview of the Centers for Disease Control.
So every 5 to 6 minutes. Mm-hmm. This is basically almost real-time updating of everything that you're seeing, any changes in nuance. Let's say we're starting to see another wave of kind of a new take on an old drug. opioids is a major issue going on right now. A lot of opioid deaths because of overdose. But fentanyl is the next wave that we in law enforcement are seeing, and it's kind of frightening on one aspect because fentanyl absorbs through the skin. You can actually be exposed by simply handling something. So it's that type of data that you're able to feed to the CDC almost real time.
Yes, sir. And that's, again, I sort of liken it to, we're like the bleeding edge of emerging trends. And I think you hit it right on the spot. Many times we hear about cases before law enforcement does or before the public health department. And it's our responsibility then to notify our partners and collaborators so that resources and immediate investigations can begin. But again, you mentioned the opioids. You know, we get a lot of calls about what appears to be an opioid overdose. We are hearing the classic toxidrome, it's called, where a patient is unresponsive, has a low heart rate, maybe a low blood pressure. That's very characteristic for an opioid. Naloxone is given emergently by pre-hospital providers. Maybe there's a response, but maybe there's not. So we get a lot of calls from our pre-hospital providers in terms of recommendations. In those particular cases, we are thinking, just as you pointed out, perhaps this is not your typical opioid. It's a very potent fentanyl or fentanyl analog that we're seeing that might require additional doses of Narcan to reverse those toxic effects.
And the toxic effects of fentanyl, you know, to be honest with you folks, Narcan may not save you. Even multiple doses may not save you. If you've been exposed to a level, this is more likely than not fatal.
You are absolutely correct. Especially carfentanil is what we are hearing in the news because it's been tested for many of the epidemics out in the Midwest where they've documented carfentanil. And I've had concerns about some of the calls that we've gotten where, just as you point out, multiple doses of fentanyl Narcan do not reverse the effects. Unfortunately, we don't have immediate bedside testing that allows us to detect those certain substances, although people are working on tests for that, especially fentanyl, to see if we can immediately identify those. And again, this data that we have helps people like you and your colleagues, law enforcement, as well as public health, to target resources, education, and intervention. We're able to map out all of our data, where we're seeing overdoses, where we're seeing trends of certain substances, you know, so that we prudently use our healthcare dollars and our resources to identify and to intervene.
Going back to your overall mission, you get a lot of calls. You get a lot of calls from the public, but I don't think that our listeners are going to quite understand that a lot of your calls come straight from ERs, from doctors themselves, from hospitals themselves. You're trying to find, you know, the answer to, okay, what are we looking at? What kind of exposure are we, here's what they've been exposed to, something kind of unique. You get all of those calls. What's the volume like?
That's a great question. The Poison Center gets about 63,000 calls a year. At least that's what we did in 2017. I can tell you our numbers are even higher this year in 2018. About 26% of our calls come from healthcare providers, from hospitals, emergency departments, intensive care units, from nurses, from nurse helplines, from paramedics that are out in the field. that have an unusual case or are wanting some information on whether they need to transport patients or not. And again, you hit on a very, very important point. Our number of healthcare facility calls have been increasing over the last 10 years. About 10 years ago, it was probably about 15% of our calls, and now that's gone up to about 26. Why are we seeing that? I think for many, many reasons. I think probably the primary reason is the patients are more complicated. We are seeing more patients presenting to healthcare facilities with what we call polypharmacy overdoses. Overdoses of multiple different types of prescription medications, as well as other types of substances, including illicit substances. Thus, the characteristic overdose patient that I was seeing 20 years ago when I first started in my practice, those are becoming less and less, and the complicated patients are becoming increasing in number. So nurses and physicians in emergency departments, again, something's not right. It's not fitting a typical pattern of presentation for a certain type of drug. In addition, we're getting calls about patients who are extremely ill, who maximal interventions have been provided. They are in intensive care, and the call is there anything else I can do? And so we, again, are very fortunate because we have such better and more sophisticated intensive care services now than we did 25 years ago. There are other potential interventions that potentially could help some of these patients, that might require transfer to a higher level of care.
I do a lot of reading, especially on topics that are really impactful to our area. And Colorado, when they legalized marijuana, the emergency room visits kind of skyrocketed. I can only imagine that the calls to the poison control centers had an impact on them, because let's face it, it was portrayed as, well, it's not a drug that anybody can die from. You can't overdose or anything else from it. But the edible aspects of this thing take that to a different level. A little brief on that.
Yes, you're absolutely correct. Our calls regarding cannabis, marijuana exposures have increased significantly since marijuana was legalized. In 2012, we got about 162 calls, and in 2017, 378 calls. Now, again, that's not a lot of calls in perspective of the 63,000, but the percent increase, the proportionate increase is quite significant, especially in the number of calls we're getting regarding unintentional exposures in young children, less than or equal to 5 years of age. Those calls went up about 58% from 2016 to 2017. And why? Because we believe when we look at the data, these little children are getting into marijuana edibles that, again, are left unsupervised in a household. And again, one of our primary missions at the Poison Center is prevention of poisonings and harm reduction. So we advocate, if there is a decision to consume marijuana in the house, to please lock it up, keep it safe if you have young children in the house. What's also interesting, and I'm a pediatrician by training, seeing the effects of marijuana on young children, it's a little bit different than the young adult and the older adult. What we're seeing in young children is extreme lethargy, seizure-like activity. So when they present to the emergency department, and I'm an emergency physician also, it's a very different pattern. I would not immediately think marijuana exposure. So many times these children require extensive evaluation, workup, blood tests, CT scans, lumbar punctures to make sure they don't have another condition that can present exactly like that.
You're talking potential meningitis being confused with exposure.
Absolutely, absolutely.
So, and not to dwell on that aspect too long, but a lot of people didn't factor in secondhand smoke in the legalization of marijuana. We see, and the schools are seeing, a lot of kids coming to school stoned because mom and dad are smoking that heavy at the home. We've even seen it where CPS goes out to check on the family, the kids, and we've had to take infants to the emergency room because the THC levels in the infants, and this is secondhand smoke exposure, were so, they were really at dangerous levels. The seizures and aspects and things like that are also compounded with the fact that psychologists in the state are starting to see schizophrenic breaks in our young people, because the younger you start smoking, the more likelihood you'll have that. Are you compiling the data of these type of exposures, and are you sending that nationally, or where's that data actually going?
Yes. That data is being compiled nationally as part of our National Poison Data System. There have been some great reports out of Colorado, what they're seeing too in young children, which mirrors exactly what we're seeing. There's 2 excellent studies that have been published. In addition, the secondary smoke, there's been a couple of studies published that have been looking at infants less than a year of age who are in the hospital with exacerbation of respiratory illnesses because of the secondary smoke also. I think that there's also a couple of the reasons why we are seeing such an effect on children is I think the marijuana, the concentrations are very high depending on the formulation. Certainly some of the resins, the hash oil, if people are vaping, sometimes these concentrations are up to 90% marijuana, which again, the air quality and little babies are not the same as adults. They breathe faster, and so the potential for inhalation of these compounds is much higher. And again, we think about as toxicologists weight-based toxicity. So the amount of substances they're getting per pound of body weight is much higher than it is in an adult. So you would expect, as Paracelsus said many hundreds of years ago, the dose makes the poison. So we're seeing more poisonous effects in young children. And that's again why we advocate to please keep these products safe and out of reach of small children, out of range. Again, if the decision is to smoke these products, please do not do it around young children.
And that's the part that I was hoping you'd get to, is just that a piece of advice to parents. If you're going to smoke marijuana, state made it legal by the vote of the people. Please don't do it around your kids because, as you said, their body weights are totally different than your body weights. The THC levels of what you're using are far greater than anything that your grandparents may have used. And this is a potential national epidemic forming on that one. Like you, I look at Colorado. They're about 2 years ahead of us on the trend line. Everything that I've read about Colorado 2 years ago, or what we're starting to see in the state of Washington as of, so folks, if you want to know where we're heading, just watch Colorado. Switching gears a little, besides marijuana, what other trends are you seeing? And let's talk about not just accidental, but intentional overdose. And when we say intent, folks, we are dealing with suicide potentials and things like that. So, what kind of trends are you seeing? We know that we have an opioid problem, which is going to turn into a fentanyl problem, which is it's always going to morph. These things always seem to morph. But the trend line that I'm kind of really interested in also is how much of the suicide potential is there in this, because our West Central area has one of the highest teen suicide rates in the nation, or in the state, I should say. And a lot of us at the local level are struggling to try to figure out, okay, how do we impact this? So are you seeing what we're seeing as far as intentional overdoses, and where do you think we go from there?
Well, thank you for that question. And I again am also very concerned about this trend. And when we visited with you in June and we discussed this, I went back and pulled some data on this, because we are seeing the same trends that you are in terms of calls to the Poison Center. We pulled some data from Spokane County from January 2017 through June 30th. And I can tell you, in the 13 to 19 age group, we are seeing a marked increase in the number of calls regarding adolescents in this age group with overdoses. A lot of these calls, in fact, the majority of them are coming from healthcare facilities. But again, when we ask the intent and the reason for exposure, the intent to self-harm and suspected suicide. And we saw in Spokane County, in that time period I mentioned, about 300 calls in that age range where the intent was self-harm. That is very concerning to me. And when you compare that to previous years, again, it's a linear line that we're seeing. We're also seeing that trend. It mirrors the state, although Spokane County, again, as you mentioned, we're seeing a much steeper trend line. And that's very, very concerning to me, because when you compare it for other reasons for exposure, certainly the young kids, it's usually unintentional exposures. That line has stayed about the same. It's about 48% of all of our human exposure calls. But that age range, 13 to 19, has increased. What's also very concerning to me is when you look at the 6 to 13 age range, and we saw a spike in calls with intent to self-harm in these younger school-age children.
Let me 6 to 16?
6 to 12.
12. Mm-hmm. 6. Mm-hmm. Folks, that's even more frightening than some of the data that I've been looking at. 6-year-olds intentionally self-harm. Mm-hmm. As a 6-year-old, I don't think I would ever thought about that aspect. Mm-hmm. I guess we do live in a society that is much more accessible to all these topics. Kids see and hear things much more, and if you are living in those type of environments, I imagine that if you've seen an older brother or mom or dad go down that road, you probably do have that situation. We have about 2.5 minutes left. You are a separate 501c3. You rely on the good faith of your partners and the citizens for funding. How do we support you?
Well, we get the majority of our funding from the Department of Health through public health. We do have a public health mission. We would really ask for your support through our state legislators in supporting the Poison Center. Our operating expenses continue to increase, and we need to maintain and provide these services. In addition to answering calls, we are mandated to provide public education and outreach, which we do. We have a full-time public educator here in Spokane that goes around central and eastern Washington, and it is available for presentations, health fairs. In addition, we do healthcare provider education. Both myself and my colleagues go around the state to provide education to pre-hospital care providers, hospitals, nurses, etc. And then we are also part of the state emergency preparedness plan in support of EMS. And all that money, it gets harder and harder as things get more and more expensive. So we ask for your support. We also ask hospitals for community benefit donation, again, to help us maintain our ability to provide services to them 24/7 free of charge.
Folks, we could have done another hour on this topic. There's a lot of information that Dr. Liebelt and I did not have a chance to even scratch the surface of this. With that in mind, anytime you'd like to come back on the program, talk about these issues, it's free access to you. Anything we can do to help with your mission. You support us out in the field at a great rate. Anything we can do to help you, we will do so. Folks, this is Sheriff Ozzie Knezovich with Sheriff's Report. Have a great day.
Thank you.
The Sheriff's Report is a joint production of Spokane Talks Media and KTW 630 AM and 96.5 FM, which are solely responsible for its content. Ask a question, recommend a guest, or watch this program again anytime at SpokaneTalksMedia.com. Have a safe day.